Good day, everybody. This is Brian Tarian here, and it's my pleasure to have Paula Walker with us, who is a Medicare expert. Paula, thanks for joining us here today. Um,
It's
so we get lots of questions, as you can probably imagine, and as you do. And what I'd like to just have you share with the crowd is, we understand that you, day in and day out, are helping people transition onto Medicare and make some very difficult decisions. But could you just share a little bit about your background, like how long you've done this, and anything that you could share with the people that help them understand the great work that you do?
Yes, I'll be more than happy to. Thank you, Brian. So my first name is Paula, last name is Walker. I've been in this business for the past 9 years. I work with multiple insurance companies that sell Medicare plans, and I've always sold Medicare plans, Medicare Supplement, Medicare Advantage, and the drug plan. So I've helped countless amount of people all over the country. I've 40 license, so I'm licensed in most states, and the company that I work for, we pretty much sell policies all over the country. So I've talked to many people from 25 up to 90 about their Medicare plans, how to navigate it. It can be very difficult and very frightening because, especially in the under 65 world, they normally wouldn't be ready for Medicare until age 65. So it's a crash course basically. So that's what we are here to do, to help them transition and answer any question and help them through the process.
Great. What I like about the work that you do, if somebody's looking for a Medicare plan, they can come meet with you. You can provide them with a lot of options, but it doesn't really cost them anything because there's no additional fee. If they were to go find a plan on their own, my understanding, they're going to pay the same amount regardless of whether you help them search and find it or they do it on their own. That's correct?
That is correct. We don't charge any fee at all, and the really great thing about our service is once I help a client, the relationship doesn't end there. It's yearly. We like to have our members call in every year during the annual enrollment period, which is October 15th to December 7th, to reassess their plan to see if it still works for them. And again, like Brian stated, there's no charge for our service at all. We can help them navigate from multiple companies instead of having that member go on to every single site and look up every medication from every single carrier. That's so time consuming. And what we do here, we make the process very much easier, and we can look at multiple carriers, and there's no charge at all to the member.
So does a conversation commonly start like this? Somebody's going to become available or eligible for their Medicare. They call in and they explain to you, well, this is my situation. I've been seeing these doctors and these are my medications and what are my options? And is that how things generally start, Paula?
Yes, that's a typical conversation with a member calling in. They're 2-3 months before their Medicare is effective. They usually get their card in the mail. It normally comes out anywhere 90 days prior to the effective date, and they call in and they want to know, is my doctor in any of the plan that you currently offer? Is my medication cover? What does Medicare give me? What is my responsibility? What do they cover? Can I use it anywhere? So those are the questions that the members usually call in. They just want to know how it works and how will that affect them and their medical coverage and cost.
So the end result, like for people that are looking at the screen here, you can go through and you're like the live version of what they could accomplish in some degree on the website, where they put in the criteria of their situation and information, and then you provide them with their coverage and their options.
That is correct. But we can do it when they go into a website. If, say, multiple plans are offered in the members area, they have United, Anthem, Aetna, WellCare, Humana. They would literally have to go into all those carriers' websites to enter their information. When they call us, with the system that we use, we're able to compare with all of the carriers at one time. So we don't have to go into every company's website. We just input the information in our system, and it pretty much help us to help the member with their option.
So you have like an internal search engine, like if you're to go get flights from, Boston to the Caribbean, you put in your dates and people. It's similar, right? Yeah.
Mm-hmm.
All right. Nice.
That is correct. Exactly. It works almost exactly the same way, except with insurance.
Yeah. Well, that's a good feature to have. So, okay. Now, there's some situations where people may come to you and maybe they're wondering, how is this going to work because I already have insurance? What do you say to those folks?
When we get a call like that, and we do get those calls where that person worked for the federal government or for the state, and they do have access to lifetime coverage, say if you were in the armed forces or something like that, like CHAMP, VA, those members have a range of options. A lot of veterans will keep their Medicare and sometimes have a Medicare plan in addition to their VA benefits, because not all veterans want to use the VA system, so they can have both. With CHAMP VA, Medicare is then the primary, and the CHAMP VA and all of the other plans from like the armed forces will be the secondary. So those members, I usually say, we don't really have to do anything for you. You already have something that's going to be your secondary, and it's going to work with your Medicare. So please go back and speak with human resource through those organizations. If it's where it's a union group where sometimes they have access to lifetime coverage, one of the questions we like to ask is, what is the cost of the plan? Because a lot of times when a member get to a certain age, the cost on that group is usually high. So the premiums are increased for that member. So what we try to do is to compare what their individual plan is to what a Medicare plan is, and then we leave it to that member to decide which would best fit their needs, because they can leave the group coverage if they need to.
So you can, again, help them go through the option and factor in what they currently have for insurance, even for
that is correct.
Even for vets, which is good. One of the things that the comments that we get, like from our support desks and others, is the kind of the darn had I wish I had known type comment. And what I mean by that is people make a Medicare decision, and oftentimes they don't have all the information that you would be able to provide them, and they're in a plan. And sometimes that works, but oftentimes because of the comments that we get, we realize they're in this plan for a while. So what do you say to those folks? They can't change until open enrollment's my understanding. But do you have any advice for those individuals that are out there thinking, well, I already got my plan. I think this is what I'm going to do. I'm just going to go do it.
I definitely have advice for members, because I talk to a lot of people like that on a daily basis. They get in a situation where they talk to one particular carrier and they're convinced by that person to choose that plan, and they go into the plan and then do not like it. And again, they're stuck with that plan for a period of 1 year. It's good to talk to a brokerage like our company, because we get paid directly from the carrier for assisting you with the process. So we have no incentive to say, this one is good, this one is good. We basically, we're working for you, the member. So there's no other incentive for us to choose one carrier over the other. We get paid from the carrier the same exact amount. So we normally are looking out for that member's best interest. When you talk to one particular company, they are trying to have you join their plan. So they're not going to encourage you to go out and compare to other carrier. Once you call them and you're talking to that representative, they're going to want to convince you to enroll in the plan. And sometimes they're great plans and they'll be the best option for you, but there's no way for you to know that unless you compare. And brokerage like ours are one of the best way to do that, again, because there's no fee involved and there's no other financial incentive for us to encourage you to go into one versus the other. We're working for you, and we match you with the best plan that match your needs.
So back to my flying from Boston to the Caribbean, if it would be like just calling up United Airlines and saying, I want to go book my tickets versus, going through the whole sorting process of like, Travelocity. So,
Yes.
okay, good. Last question I want to ask you, and this has been great, is if you could just explain to the folks a little bit more about open enrollment, when it is, how it works, so that they're aware. And again, this is my understanding is this is once you're on a plan, you're on a plan, but open enrollment is your opportunity to make a move. So, what could you add to that, Paula?
We tend to confuse open enrollment with the annual enrollment. The open enrollment is when you're first new to Medicare, and that's when you're choosing a plan. It's usually 3 months prior to your effective dates and 3 months after. The annual enrollment period, which is October 15th to December 7th, is when you can change your plan. So you have that 6-week window. If you choose a plan and you're unhappy, that's when is the time to call us, and we can reassess your needs for the 2017, because no plans stay the same every single year. And say, for example, you're on a prescription and it was a tier 3 this year, but next year it's being transitioned to a tier 4. But another company may have that prescription at a lower cost. Or say if your doctor told you, I'm no longer with WellCare, but I'm going over to Humana, then you have that opportunity at that time. The only time the exception for those changes is if you qualify for low-income subsidy from Medicare to help with your prescription, then you get what's called a special election period to change your plan at any time. If you're moving out of the service area and the plan that you have is no longer offered or will not be offered in the new area that you're moving to, those are some of the times that, or if you're losing coverage from a spouse or an employer, those are the times that you can pick a plan without it being that 6 week. And when you choose the plan within that 6-week time, the plan does not restart until the 1st of the following year. So you have a deadline of December 7th. If you don't change, you're pretty much stuck in the plan that you have. And that's not a good option if you're unhappy with that plan.
So my take is there's so many variables. The plans change. Your health can change. Better, could get worse. You could be on different prescriptions, and there's so many plans and so much movement that it's like it makes good sense for anybody that wants to maximize their income in their Medicare to place a phone call, right?
Definitely, I always tell my client, whenever I enroll them, I tell them, I said, I am your agent on record. Please give me a call. Put me on the calendar. There's everyone. We still carry, if it's not on our phone, we have a calendar in our house somewhere. I always say, write my name, call Paula,
Yeah.
October 15th to December 7th, and they usually call me to reassess the plan that they have, because again, you keep a relationship. We want to know that our clients are doing well and are happy with the plan that they have, and to make sure that they make the changes, because they'll call you down the road because they forget to call you, and they're like, oh my God, Paula, I went to the drugstore and I had a $360 deductible on my medication this year, and last year when you signed me up, I didn't have that. And then I go, did you get your evidence of coverage for the new year? Because they normally are sent out at least 60 days prior to to the new year. And they go, I got it, but I just kind of put it aside. I didn't realize there was any changes. It's very important that you look over that booklet or call me back and we'll review it to see if it still matches your needs. So it's no plan, just like any other insurance plan. Like when you were working, your insurance changes every year, and it's good to reassess that changes every year.
Yeah, that's fantastic. So makes good business sense. Well, listen, in closing, I just want to say to everybody out there, well, first of all, thank you, Paula. But if you want to contact and speak to a Medicare specialist, Paula or one of her associates, the number is on the screen, but it's 877-670-4501. Again, that's 877 670-4501. Paula, you provided some extremely valuable information today. I thank you very much for taking the time with us.